Which Master Cho, Miigwech, Elder Dr. Deb for a beautiful opening and for sharing this beautiful lodge with all of us. And we're very grateful to be here and to be part of it. My government name is Suzanne Stewart, but I use my name in my language given to me by my grandfather. It's not a spirit name, it's just an everyday name. He called me Etsy, means grandmother. Etienne means little grandmother. So when I was a baby and they were looking after me for a few years, that's what he decided to call me. So that's what they called me. My spirit name is Eagle Woman with Running Buffalo, and I'm from the Eagle Clan of the Yellowknife Dene First Nation. I'm also a professor here. Everybody I think here knows me. I'm the director of the Institute. We're hosting this beautiful event this morning, and I want to welcome everyone here and welcome our speakers who came from all across the world, from Australian, from, oh my gosh, the Indigenous people of Australia and the Torres Islands. So massive show to them for coming. And what I'll do before I introduce our speakers is just let everyone go around the circle and introduce themselves, who they are and where they're from. And then everyone here will be able to learn from each other as we learn from our special guests, Dr. Michael Doyle and Kai. And Kai can't remember you. That's okay. I'm sorry, but I'll let you guys introduce yourself. So welcome to our guests and welcome to everyone else. Matthew Cho.
Hi everyone, Liam, Irish, Scottish. I'm a research assistant here and a psychotherapist in the community as well.
I'm wonderful.
Hi everyone, I'm Samir. I'm from Cape Town, South Africa, and also a research assistant here. Thank you so much for having me. Appreciate it.
Hi everyone, I'm Sabina. I'm a postdoctoral fellow at WACA-NS. I was born to South Asian immigrant parents, and happy to be here.
Hi everyone, my name is Michaela Gabriel. Sorry, she actually means it flappy with me. The first spirit name I was given is Laughing Swan, but I received a new name or another name in ceremony, which is On Her Swings Brings Thunder. I'm Mi'kmaq of Gowngook, which is now known as Newfoundland. I'm a clinical psychologist by training, a research scientist at Unity Health, and a professor at WACA-NS. And I was going to joke that we've since adopted Sabina, so that's why I was smiling during that first part of my check-in. Happy to be here.
Everyone, good morning. My name is Shiva Acharya. I work with the Twitch First Nations as a researcher in one analyst. I'm from Nepal, back home, living and working here since last year. Thank you.
Hi, my name is Julia Matheson. I come from Kaiwarr Heritage, and I am a research officer in Memphis State.
My English Australian name is Michael Doyle, but I'm NEIHR. Barnagood is my name by people from the tropical north in Australia, not far from Indonesia, a lot closer to Indonesia than we are to Sydney, where I currently work. And I'm presenting. And thank you, Dr. Deb, for the welcome. And yes,
My name is Kaiwarr, Clancy. I'm from the Waka Nation, the east coast of Australia. I'm a research associate at the University of Sydney, and yeah, I'm really happy to be here presenting. Thank you.
Hi, good morning. My name is Billy Joe Hardy. I'm from ancestry and West Indian. I was born here in Toronto, but raised in Lesotho and in Dragonese Territory, Yellowknife Dene First Nations. I am an assistant professor at the University of Toronto and the assistant director at. Hi everyone, my name is Shanti. I am the coordinator for the Ontario NEIHR. I am from Treaty 1 territory, also of mixed ancestry.
Welcome to our speakers. We're so happy to have you here. Welcome to everybody online as well. Which
Morning, everyone. My name is Sophia. I have mixed ancestry. My mom is Pakistani and English, and my dad is Serbian. And I'm one of the Master of Public Health students who very happy to be here.
Hi everyone, my name's Sarah. I'm Inuit in Gwich'in. I'm originally from Edmonton, Alberta, and I do communication admin support at Welcome.
Good morning, everyone. Welcome back, Michael. Pleased to see you. My name is John Wamagujik. I'm the admin research coordinator at the Institute, and I'm from Saskatchewan First Nation, Ottawa. And I wanted to share something with you guys today. Today is my 13-year anniversary. Or that would have been very 13 years today.
Oh, congrats.
Yeah, thank you.
Ojo, Kwe, Sinikwe, Ninjaba, Wakakdorum, Yavampas of Pikawaka. Ninja. I'm Sue, I'm the knowledge keeper for Wilderness, and welcome to Canada. And yeah, and I'm good. Anyway.
After, you went, you introduced yourself.
Oh, right, that's her, well, there it is.
Way, everyone. My name's Alex Egan. My spirit name is Man Who Travels the Stars. I'm originally from Kukumuk, the island of Newfoundland on the East Coast. My ancestry is Mi'kmaq, Maliseet, Passamaquoddy, and Western European. On my mom's side, Indigenous. My dad's side is English settlers. I'm a research assistant at the Wilderness Institute since a couple of years now. I'm also a PhD student. Social and behavioral health science. I'm a social worker, registered social worker in forensic mental health, and also have a background in Indigenous child welfare. And I'm hoping to focus on, for my doctoral dissertation, the intersections of the climate crisis and two-spirit mental health.
Good morning. My name is Zarian. I'm a member of Paxton Nation in British Columbia, and I'm a PhD student here at GoT and also a research assistant.
So I'll turn it over to our speakers today. Welcome, Dr. Michael and Kai, and please get started.
Thank you, Ian. Betsy. So we're presenting on a development of a new program. I hope everybody online can hear me properly as well. Yep. A few years ago, I finished my PhD in 2018. I was looking at drug and alcohol treatment prison system in Australia. And it was pretty clear there was very little for our mob in prison, and unfortunately there's this huge over imprisonment. And so as part of my work after I started to develop a program that would possibly be rolled out to different prisons in Australia. And that's what we're presenting on today. I've done that work with Kai here, of course. Also, I want to specifically mention Dr. Alison Evans, who's not here. She does the day-to-day management, which is very amazing, and as well as Anna Greger, who's one of the research assistants. Now, we printed a few copies. I had a little bit of a frustrating time at the print shop this morning, but that was okay. And then the fellow there said I had to pay cash, so ran down the road and came back. So we got 12 copies, so not quite enough for everybody, but
we can, we don't usually use paper here because we're paperless. You can just email it to everybody.
Okay, cool. Yeah. Thanks, Betsy. Yeah, I've gotten very used to sort of following the slides when I talk. So I want to acknowledge the traditional owners of the lands on which Toronto University is located. For thousands, and I got this from your website, so I should preface that. So for thousands of years, it's been the traditional land of the Haran-Widat, the Seneca, and the Mississaugas of the Credit. And today, this meeting place is still home to many Indigenous peoples from across Turtle Island. Very grateful to have the opportunity to work on the site today. So we're going to talk a little bit about the background and then scoping review as well. And then Kai's going to do the really interesting part of the presentation, which is the sort of about the poll work where we went out and interviewed some Aboriginal and Torres Strait Islander researchers, workers about what they thought was the best way to work with our people. So in terms of the background, we have a very high imprisonment rate. We're about 3.8% of the Australian population, but we are about 35% of the prison population, and the rate of imprisonment is somewhere around 2,000.
Louder.
Okay. The rate of imprisonment is around 2,000 per 100,000 people, and that rate of imprisonment is, we believe, the highest rate of imprisonment of any minority in the world. Imprisonment of Indigenous Canadians is also incredibly high as well as Māori in Aotearoa, New Zealand. And other minorities, of course, like African Americans, are very over imprisoned next door down south of here. Yeah, so there's this real need to do some work around that, but to reduce imprisonment in the first place. And so today we're talking about how we could better work with people who are in prison, but we're very conscious this is one part of it. The big part of it really is to stop people going to prison in the first place. And we're not really focusing on that right at this point, but we're hopefully, if people do get supports they need, get connected up to programs, they're less likely to return into prison afterwards. One of the overall driving factors, though, is homelessness, which is really ironic for Aboriginal Australia because we didn't have any homelessness. We went and presented at NAMI Res on Monday. That comes up in some work we did with them, but it's also something they speak a lot about at NAMI Res as a major issue for supporting people here in Toronto and across Canada. So we have a lot of intergenerational imprisonment that's happening now as well. And so when I did my PhD, there were two of the fellows that had actually been in prison with their dad. One of them had actually shared a cell with him. A lot of Aboriginal people who go to prison were in out-of-home care. And that's a much higher proportion than for the non-Aboriginal people who are in out-of-home care as well. So it's like 1 in a quarter or something about that. We have the stolen generation in Australia, or what we call the stolen generations. It's very similar to what you would call the residential schools program. And we have similar effects. But that particular group of our mob have been more affected by anybody else from colonisation and the intergenerational trauma. So there's lots of sort of generational indicators of poor health, but I just want to reflect prisons have a way of collecting anybody with disadvantage. And so a lot of the people in prison, the non-Aboriginal people in prison, also have major sort of issues of their own, substance use and those kinds of things. But our focus is, of course, on Aboriginal people. So I spoke a little bit about the imprisonment. So when I was looking at what we should do for perhaps doing a program in the prison, the advice I got from our elders and others was we should be talking about what we term as social emotional wellbeing, and rather than looking at the drug and alcohol sort of triggers and those kinds of things, and because that's what most of the programs currently are. And we should be taking a much broader view of being more sort of holistic, speaking about the whole wellness of people and communities. And so when I sort of looked into this a bit more and put the ground, and we used the social emotional wellbeing model, which was developed by Professor Pat Dudgeon and co. And so there's a sort of a printout you'll see on the printouts. But it has all the different components. I won't sort of speak too much about it, but we found when we did the data analysis, all of our data kind of could have been coded into the social emotional wellbeing model, and so it was incredibly consistent with what we found in our work. So when we started this program work, we thought it would be best to do a scoping review. And for that, we did use the Joanna Briggs method for systematic reviews. And we looked at both the grey literature and the peer-reviewed literature. So the grey literature, we contacted your Department of Correctional Services at the federal level in Canada, as well as some of all of the provincial departments as well. We did the same in Australia, and NEIHR they don't have states; they just have a single federal government. So we went to the New Zealand Corrective Services. We had a little bit of a look at the US, but it's too many jurisdictions, so we just looked at the federal level. What we found through the grey literature was there were about 32 programs we found in Australia. We of course have better access to information in Australia to know some of these people, so that might account for some of that. But we got told about 18 programs here in Canada, and there were 7 programs in New Zealand, and then there was 1 program we could find at the national level in the United States. So I won't go into too much detail of the systematic review, but you've got the sort of printout there with how that all worked. And we are finalising that and hopefully submitting that for publication soon. So that'll be the first time, I think, on sort of that international levels anybody's done that bit of work. So that'll hopefully be helpful for people once we've published that. So we found most of the programs mainly targeted men. They were a mixture of both traditional cultural education program education as well as Western models. And some of them had one-to-one counselling as part of that, as well as a sort of group setting. And all programs were co-facilitated or were exclusively facilitated by Indigenous peoples. What was kind of really good was seeing that they measured social and emotional well-being and other sort of different outcomes. One of the problems in the prison is that they seem to just measure return to prison as the only thing that they kind of mainly measure, and that doesn't tell you very much. But the way in which the Indigenous programs were measuring outcomes was really, really good to see. So there's a few examples I've got written in the presentation, but we have spent a little bit of time in BC just before coming over, and their sacred space gatherings program was I guess one of the highlights we found for the programs in Canada, and that was developed by Elder Jerry Oldman and Laurie Cruz or Laurie Richards. Laurie retired last week. But there are a number of programs you've got available in Canada. What we found with our programs was that the ones that were available at specific prisons, and were pretty dependent upon 1 or 2 people who were locally based, and they would go in and do the program. And so they were very localized. So that's probably the main thing about the sort of scoping review we undertook. I'm happy to talk a little bit more about the rest of the program now. And so, yeah, if you want. Yeah. Oh, yeah.
So, well, my part of the conversation shortly. I'll be talking about the results of the research that we did, and also one of the outcomes was to develop a social and emotional wellbeing program for young men in prison in Australia. So with the research that we did, the aim was to speak to Aboriginal and Torres Strait Islander healthcare workers working across social services and drug and alcohol services across 4 different sites, 2 in urban sites and then 2 in regional sites in New South Wales and Western Australia. So the methods that we used was we used a qualitative yarning method where we sit down and do semi-structured interviews 1-to-1, and then also followed up with focus groups as well to report back and report back our findings to the healthcare workers and have the yarns and discussions about our findings. And then we use the thematic analysis to collate all of the information together and come up with some themes. And with those things, we created a program from that. It's like the evidence to make the basis of the program. We had 27 participants in total. It's about 50-50 men and women, slightly more men than women. One of the sites there was just totally men, and then the rest were mixture of men and women. So the first research question was what are the cultural ways of working? And so we have different ways of working. What we found was all of the workers were saying that they prefer things to be led by the clients and client-centered. The space and the structure of where they were working was really important. So not having a clinical sort of space, having something that was more appropriate for our mob. So settings like this, for example, would be more appropriate outdoors and in a cultural setting. Building trust and rapport with clients, so having that relationality and that building that rapport is really important. And also making sure that that cultural safety is there, so making sure that people were understanding of Aboriginal culture or from the same cultural background is really important. Strengths-based activities, so doing things that made our mob happy and proud, like I guess cultural activities was another example of that come up in the research. Something that was an activity that made our mob happy, and then the cultural principles. So like having this, that cultural knowledge and that cultural protocols really firm with their ways of working was really important for these workers. And then the second research question, we had the way that health professionals work with clients and their connection to culture was at the center of that. And I guess when we talk about what was important to them and what would be used into a program, the main things that come up from that was personal and family health. So not just the individualistic sort of way of looking at health, we're also looking at the health of the whole community and the health of your entire family. So that could be your own physical and mental well-being, but also looking at things like relationships, family and domestic violence, health of your children as well as the mothers. And then another thing that the workers were saying that would be good for a program was education and behaviour change. So what that encompassed was looking at programs that help with drug and alcohol addiction, looking at things that help with tertiary education or vocational education, help people get into employment, and also further education. And another thing to sort of like back all of that up would be cultural activity. So attaching a cultural activity to the learning to make the, I guess, the experience or the engagement more appropriate for our mob instead of that sort of like that lecturer style clinical in a classroom. This is what you do. This is what it, having something that's taught with a cultural activity would make it more engaging for our mob. So yeah, so when we did want to sort of like create a program, we looked at all those things and we come up with a curriculum. And the way we designed the curriculum was we had the idea that it would be led by Aboriginal Torres Strait Islander people, but also like by peers. So a lot of the people that we interviewed and spoke to really put a heavy importance on having peers. And when I mean peers, people that have the lived experience of either drug or alcohol addiction or being in prison themselves. The people that had been to prison, especially the ones that we interviewed that were also peers, they put a really firm importance on the success of their programs coming from peer-led models. So that was really important. Having technology as well. So moving away from the paper style technology, but some of our prisons in Australia are moving towards having tablets and different types of multimedia to do their lessons. And we think if we're going to be funded to do a program, it would have to be something that was also mixed media as well. Being able to like do the lessons on a tablet as well. Having the cultural activities integrated. So when we spoke to workers, one of the really important things about having cultural activities is making sure that they're appropriate for the land on which we were feeding on. So having the traditional owners of the land help guide and direct what sort of activities would be appropriate for the prison. Instead of just having a homogenized style activity that wouldn't be appropriate in an Australian setting. So yeah, having different cultural expertise from each country would be really important. And having a flexible delivery as well. So having Indigenous and non-Indigenous being together in the room. So some of the men that we spoke to suggested a heavy importance of having non-Indigenous men in the classroom setting, especially from if they have Aboriginal children. It's really important for them to be able to teach those teachings to their children as well. But also another suggestion that came up in the interviews was from a security perspective as well, that it could cause, divisions or something within a jail setting. So having everyone included was something that was important to some of the men.
But majority Aboriginal.
Yeah, not majority Aboriginal. So the structure of the curriculum and the content would be the first few sessions would be a welcome, with welcoming ceremonies such as smoking ceremonies, cleansing ceremonies for our people, and getting to know each other, checking in, making sure that people put their heads up and trying to slowly introduce the content that could be quite triggering as well. So there would be topics such as family violence or drug and alcohol, where people might feel like they're implicated themselves, but just giving people a heads up, this isn't, directed or targeted at you. This is a learning for everyone. And then in the middle of the curriculum would be the more heavier sort of content where they do touch on those topics and have that sort of key learnings around those sort of themes that I talked about earlier. And the closing would be to also check in again and perhaps do a sort of graduation ceremony towards the end, and have something that people can take away and be proud of. So with the curriculum, we did come up with about a draft. In our draft curriculum, we came up with about 10 sessions, and yeah, they cover different topics with
Application.
Sorry. Sorry. I've got to change, solid relationships, mental well-being, A&D recovery strategies, and different topics of drugs and alcohol. So yeah, there's a really long list of content and topics here, but we did come up with about, I want to say 40 different sessions. 40 different sessions that we identified that people would like to learn. I won't list them all out because I'd just be repeating myself, but there is a possibility to extend this to 40 odd learnings. And I guess the modality could be anywhere between 10 weeks to the whole year, 40 weeks. But yeah, that's pretty much it for what I've got.
Well, thank you, guys. Yeah, and Kai's done an amazing job with that. As we say, we had up to 40 sessions. We focused on getting a 10-session package. The reason why we wanted an actual curriculum was so that we could do a train the trainer, and so it wouldn't be kind of then dependent on having a single person who knew how to do the whole thing. And so we would, as we move forward, the next steps are to do a pilot, which will be in New South Wales. We've been told we're getting some funding for that, which is good. I believe we got the funding when we get it in the bank, though, because you know what government can be like. So that'll be the next steps will be piloting and then rolling the program out. So we are really conscious about how this would be delivered in quality and about people being able to learn at their own pace. One of the things that came up was to have role plays. So not have sort of paper-based stuff like we have today in academic sort of institutions, but to actually just role play some of the scenarios so people can learn and talk and do those things as they go through, and acknowledge the knowledge that everybody in the room will have of those particular areas that they're learning about. So cultural activities, not all of them will be able to be done in that kind of a setting. So you can't quite go out hunting if you're in prison. You did a lot of the work on this, but we might be able to do like some traditional song and dance, cooking, those kinds of things could be done within the prison setting. So there's some restrictions. It's been really well received, and yeah, we're gonna move to the next steps soon. I think that's the main parts of it for today's presentation. Yeah. We're very dependent on PowerPoint, so it's good to be challenged and have to do this as we are right now. So
thank you.
Thank you. So happy to take any questions.
Comments or questions?
Yeah.
You guys do a lot of work with prisons and that, right? With the inmates and stuff?
Do we do work in the prisons ourselves?
Yeah, do you guys go in to the prisons?
I do a bit, yeah. Not so much the rest of the team. I go in fairly regularly and do different things. Right now, I'm reviewing what is the National Health of People in Prison report for Australia, and there's three Aboriginal people on the committee, but the other two are kind of in, they're not available right now, so I'm reviewing the whole thing. But yeah, we do a lot of different kinds of work in the prison system. Yeah.
You do a lot of circles?
We don't do because as researchers, we don't do the actual sessions. But yeah, I've been in or I've attended the programs, but not facilitated, if you get what I mean. Because we're not really sort of service delivery people as researchers. You get what I mean? Yeah. Yeah. It's do you know what's really interesting and a bit sad is the Koori fellow, Koori is Aboriginal in New South Wales. When I meet them, often they just want to find out about university and they've never met another Aboriginal man who's ever been to university, who's ever worked, and it's really kind of telling at times that they're what's normal is what you see around you every single day, and for some of them, they've grown up with such circumstances that they've been exposed to from colonisation intergenerationally, that people that not working and that using drugs all day and that doing those things have become quite normal. So it's kind of but that's just building a little bit on what you're saying. So it's showing and being something different. They usually want to be a league star or an AFL star, Aussie Rules star is the main goal they've had, and they don't have very many other role models, if you get what I mean, to what could be different. And then you of course have toxic masculinity within the prison system. You can't show any weakness. And I think that doesn't help them as well, because if you talk to them one-to-one, they can be they're like frightened boys. That's been my impression when I've talked with some of our Koori fellas one-to-one. When they're in a group, they tend to be like, I want to be this big tough man, and I know everything, and I'm not going to admit weakness. So getting to the point where you can start to get through that shell, so they're vulnerable. You need to be vulnerable to be able to learn, and that can be a bit of a problem. With what we've found with culturally based programs, if it's done well and the facilitators trust it, you can get there a lot faster than you do in mainstream programs. So there's a real advantage with that they might be more willing to open up and start to talk. A lot of the fellas are at different stages as well with their own cultural journey, so they might not know very much. Some of them know a lot, but they tend to be pretty generous with each other when sharing about some of those knowledges. I'm just talking now, and I don't know if that got your question.
Yeah. No, it does, because the prisons here, they have somebody they can go and talk to, like an Indigenous worker, and they go and smudge and they have one-on-one. I was just wondering, do they do that there in your prisons?
Yeah, some
Are they able to have 4 elements like the sage, tobacco, cedar, and sweetgrass? Sorry. Yeah.
Yeah, we do smoking ceremonies. There's different types of eucalyptus tree that we use to cleanse, and that happens in, I would say, most medium settings.
Yeah, medium
low settings.
Yeah,
Yeah,
but it's not as regular as you'd like. Yeah.
I'm just wondering about the frequency of how, so you have 40 different kind of trainer programs that can be implemented into the prison system. What would be the frequency of access, and is there, or have you thought, we looked at any sort of traditional programs, and when people come out, is there access to ongoing?
When we look at doing either twice a week or once a week, I guess when we really, once we really know is when we get the pilot program sort of set up, what works for that person. But our idea was to have at least once a week. But it could even be quicker to be twice a week. I think one of the feedback from the men was if we had it twice a week, it would be more engaging because it gives us more structure to tap into that program. And I'm doing it Tuesday and Thursday. Tuesday, Thursday. Yeah.
Yeah, and so just short, they have about 3 hours a day where they can do stuff, programming, Monday to Friday. So, but yeah, so thought 2 to 3 times a week would be ideal because then they can go away, think about, talk about, and then come back in a day or two. And then, so it helps sink in is the other bit of information we got was if you do every single day, they don't have as much time to reflect on what they did the day on that day, if you get what I mean. So yeah, but it could be up to 40 sessions, and some of them are really, and this to cross over with other research, but just really basic, what we would say basic, sorry, I should say just straightforward life skills like learning how to wash your own clothes. But they've just not had some of the fellas of that experience or how to cook, how to do those things. There's other kinds of interesting things we found during this, and Kai found this when we looked at resources around interpersonal violence. They were really kind of very much men as perpetrators, women as victims, but there was nothing for two-spirited people. There was nothing that was more gender neutral. And so everything, if we wanted to use any of those materials, we'd be going in telling the men, you're the perpetrators of violence. And that's not like the place to start the conversation. If you go in with those kinds of resources, so we found some real gaps in the way in which some of those materials were made, and not sort of saying. So a lot of the time that is what happens, but it's just probably not the way to have introduce and have that conversation. But there's just nothing. If your partner was another male, there was absolutely nothing to talk about that at all. Yeah.
Wondering if you guys found any other difficulties or hurdles in sort of service delivery or group dynamics, things like that.
Service delivery, and I'll circle around to the post-release bit as well, using that as a segue. So some I'm borrowing bits of knowledge from other places when I answer this question. So it's not strictly speaking exactly from that data, but people didn't know what services there were available in the community, and so teaching that we've got place called the Aboriginal Medical Service in Redfern. It was our first service. It's like the same as NEIHR Health here. But not everybody knows that exists, even though they live in Sydney, which was kind of weird to find out. But we work in health research, so we kind of knew that. So telling people where there are services that are Aboriginal specific, but also mainstream services, if they feel more comfortable going to those as well. Was a real gap. People often don't know what is available, even yeah. Other gaps in the post-release. So part of the funding for the trial of is to build in a post-release component. So it'd be how do you refer, how do you support people into post-release as well. That's a huge gap, and people are often released with just the clothes they were wearing on the day that they were arrested, and that's all they have. They don't have anything else, and they give a train ticket or something, and they end up in the middle of town, in the middle of the city, and that's what do they do? And they don't have a phone or anything. So post-release is a huge challenge. Yeah, so we're building in components for that. At this stage, the focus was to build like a base model, if you get what I mean, and then build on other components as we go forward. Yeah. Does that cover that?
I wanted to ask about the attitudes and the culture of Australia as a settler nation. Has Australia participated in truth and reconciliation, their own truth and reconciliation process? Where do you think that a nation state is in that? Do you feel that you have political support? What are the attitudes of Australians? What types of attitudes and cultural beliefs do you encounter in your research and in your work?
Thank you. Great question. We are in the lodge, so I'll use respectful language. So it's become worse than it has before. And so by way of example, we have Anzac Day, which was on Saturday, or we had a holiday officially on Monday, and that's a war memorial to remember people who've been in the war, basically. And so there's a march. So at those services, there is normally an acknowledgement of country or welcome to country, and there was this coordinated effort by right-wing fascists, if you like, to heckle and attack the people during the acknowledgement of country, and so that happened in most places.
Veterans.
Yeah, and these are our veterans who actually fought in the war being heckled by these white people.
They were filming during his talk.
Yeah,
They booed him.
and it was pretty bad.
And you're saying this is an example of something that happens.
This happened just this week. This happened this week. So I really don't like mentioning the name of the person who's running the place south to you. But since they returned to office, it has gotten much, much worse. It has given license for people to be openly racist. There's a lot of racism that comes up in work with Army Res here in Canada that they talk about, but it seems to be a bit more polite in the way in which it's expressed. There's such a thing as being more polite when being racist. It's more overt these days and in your face. That probably covers a bit of what you're talking about.
The second part of my question was if Australia's done any truth and reconciliation process, like South Africa, like Canada.
So there has been attempts to do truth and reconciliation. We have, the Prime Minister say sorry for stealing your children, but the issue is they keep stealing the children.
Right.
But they just have a different name for it. It's called foster care, out of home care. And they have a different framework, but it's the same sort of thing. Taking the children, putting them in homes, putting them in group homes. The same thing's happening, and it's causing the same traumas all over again. And it comes up in our research. A lot of the prison population have that lived experience of out of home care. But then you look at their grandfathers, they were in the dormitories, in the missions, the stolen generation. And we have Reconciliation Week as well, a week that recognises, cultures meant to be coming together, but honestly, it's all show and parade. It's nothing really reconciling. The referendum, you want to speak on that?
Yeah.
The voice referendum?
Voice referendum.
Yeah.
I'll come to that in a second, but we don't have a national initiative at all for truth and reconciliation. That's not been something that has happened in Australia. They kind of write reports and then those reports just get pushed away. Some of the jurisdictions have done that, but locally at Sydney University, we're doing some work on that as an institution. We had a referendum in 2023 to establish a voice to the Parliament, and that was that all matters specifically related to Aboriginal and Torres Strait Islander people would have to have consultation with this body that would then be set up under the constitution of the country. So it means every single government would have to have this voice and talk to them, this body. That got defeated by 60% to 40%, 61 to 39% defeat. And so the message from that is that Aboriginal people do not need to be consulted with about matters related to Aboriginal people. Apparently, majority of Australians don't believe that.
They were meant to have the truth in that as well.
Yeah, the truth and yeah.
Body.
Yeah, so there are meant to be a number of things embodied within the voice, and it would have been a truth and reconciliation process that would have resulted out of that. That did not happen, and the racism directly or during, before, and after was pretty bad.
Just got worse.
It got worse, and yeah, so I also think white Australia has a particular brand of racism and has a particular paranoia because Australia lives in Asia. Our next door neighbour is Indonesia, 200 million people who all are about my colour. But they're all, so this is a group of white people that live a long way away from many other white populations. And I think they're particularly paranoid about that. And this is why we've had policies like Keep Australia White, the White Australia policy, those kinds of things. Yeah, it's not a pretty picture, and it's an ongoing kind of saga. Just we could all share a few personal stories, but on the flight out here, we were on Qantas. I got upgraded. The university won't pay for an upgrade. They just gave me one. I was challenged about using the bathroom. I was told this bathroom is only for business class and premium economy passengers. And I was like, but I'm a premium economy passenger. And the stewardess just stopped. Was like, oh, okay. And that's kind of very typical of the passive, more like you get you in your face racism, but just getting challenged about being in particular places. I'm sure a lot of other Aboriginal people have those stories. So yeah, so a long way to go. So some of the driving factors for over imprisonment is the over policing of Aboriginal and Torres Strait Islander people. We are more likely to be pursued through the court system for a charge related to cannabis and non-Aboriginal people. This was a really good paper in New South Wales. Police will give white people a caution and say that's very bad and confiscate the drug. Aboriginal people, you'll get charged and end up going to court. And data shows that very, very clearly. And that's one example of how the system works. But sounds a bit hopeless, doesn't it? We keep on keeping on. I mean, there are good people who we work with, I should say as well.
Well, that's unsettling. I would like to, think that maybe the United Nations could do something, but I don't know that anyone really has much faith in UN these days. But possibly grassroots movements. I don't see why the people of Australia have any say on the rights of Indigenous peoples. But
yeah, I was thinking. Correct me if I'm wrong. Did Australia not sign up to the UN Charter for Indigenous Rights?
No, I don't know.
No, they didn't.
Yeah, they did it. They don't care.
Wasn't it only just a little over 100 years ago that it was legal to shoot Indigenous people?
Oh yeah,
Land?
100%. Yeah.
Yeah.
Australia.
And then they were recognised as people in 67.
Yeah. So there's a long way to go. Yeah. What else to say to that? So
I'm sorry to hear that, and we don't mean to dredge all that up. So I know it's really difficult to live like that. Having just been there, I was just there in March with Keith and Shiva.
Yeah.
And we had a wonderful time hanging out with our Indigenous friends, but on the street in the cities, I did experience the kind of racism you get in Barrie or small towns around here. Toronto, we don't get that. If you go out west or small towns, you get that on the street, like in your face, like really bad treatment. It's like that in the cities there. It's not. Like going back in time 50 years here.
Wow.
Or out of the city.
Yeah. It is definitely. I'm sorry that was your experience. I'm not surprised though.
It's not a big deal. I had my daughter Raven with me, who's really white, and she was just appalled and angry and wanting to like beat people up everywhere we went. I'm used to this. I grew up like this. It's not a big deal.
Yeah.
She's like, "Oh, Mom."
Yeah, it is, and that they don't is part of the problem. Not looking in the mirror and then ability to recognise what's actually going on as well at times. But yeah, so that's the background of where we what bit of what the backdrop of it.
Did you have a question?
So I have one more question really quick.
There's one online.
Anyone else?
There's one online. There's a question
Okay,
online.
want to read it out?
Sure, it's kind of long, so I'm gonna try and.
Parts it too.
Yeah, but they said, thank you, to everyone for the honor and privilege of being a part of this space. And this is someone who works directly with, Correctional Services Canada. Yeah, with individuals under its governance. And so they've had some concerns about the process of contracting elders. Just because, so they're concerned that while the intentions appear to be well-meaning, the elder is contracted and employed by Correctional Services Canada, so it is expected that they are able to, what they're able to or not able to do and how they're able to go about it are all governed and regulated and controlled by Correctional Services Canada. So that can detract from what these experiences and interactions ought to be. So they ask if this is similar to how it is in Australia and if there are any concerns or thoughts around that.
Yes, is a quick answer to that. Absolutely, there are. They're such controlled departments. They're all about control. And as far as what Australia goes, corrective services was was Arthur Phillip, who was the first governor of Australia, as they would say. But you can draw a direct line from the current Commissioner of Prisons directly to that person. So they're it's very, very hard to get change within those departments. You kind of have to be their friend from the inside to push them. Like if you have to try and become friends with them and then try and get them to change, because it's very, you have to, what they call that, like influence it from the inside. From the department. We're kind of doing that. Well, kind of doing that a bit right now. So they've become more friendly to me lately, which is very good. But yeah, in terms of the elders, a lot of people don't want to work in the prisons because it's not a nice environment at all. People find it challenging with knowing your family in there, because a lot of if you go to work there, you'll be related to people inside there, those kinds of things. But they end up being really very closely scrutinised. For elders specifically, I couldn't necessarily tell you about that, like because I think there are a couple of elders who do go in and they're better off. They're better placed to talk about their experience of those things. But control is the sort of mantra of the department. And yeah, it's changing a bit, but not enough by any means. I don't know if that covers the person's question online, but yeah, it's probably the best answer I can give you at this stage.
Anyone else?
With this more for the prison and stuff like that. Do you know if in the Australian prison, if they have it's called like a native brotherhood? They have one there?
The brothers look after each other. Yeah.
Yeah.
It's not like a formal network, but yeah, so.
Yeah, but I had a brother who in College Bay, he had a chapter there. And I was just wondering, if, like, in other countries, if they had that.
They definitely stick together.
Yeah.
Definitely,
Yeah.
yeah.
Right, it definitely divide by race in Australian prisons.
Yeah.
So it,
Like white fellas, Asians.
and you do have like different sort of groups that are like almost like gangs. Well, you get gangs in prison, but we don't quite have the same kind of gangs as you do in the prison system as you would say in the US and places. But you do have racial groups, and the Koori mob, the boys will stick together.
Yeah.
Yeah. They'll look out for each other. Yeah. So yeah. With programs though, one nuance, there's a couple of things that are unique when we do stuff with us is that some of them may have actually grown up together, and some of them might be, if they're talking about something that might have happened with their partner and saying, I was really sorry that I hit her, she might actually be the other fella's sister or cousin or something. And so they might know who you're talking about when you're doing stuff as well. So there's a number of sort of things in that are a bit different. Yeah, does that cover that bit? We definitely, they all look after each other. When I was doing my PhD, they reckon, well, if you came in, we'll look after your break. You can write our reports for us.
If you guys have like when the inmates come out, Indigenous ones, do you have like a halfway house where they can go and get back into the society and stuff like that?
Not
help them get a job and stuff.
yeah, not Indigenous specific. Mainstream ones, yeah. I've got a couple of those. Yeah, but there's we've got resi rehabs which people can go from prison to going to a residential rehab. I've done a bit of work with the Glen, which is men's one. But there isn't. So often people are just released back to the same situation from which they came from, and then they'll return to the same behaviours and all of those things. Yeah. So it's kind of a circular thing where they'll go in and out.
Right.
Yeah.
Okay.
Yeah.
Cool.
Okay, so I think I'll just leave it there because people are getting cold and restless. So I'd like to thank you very much. And I feel like we have a lot more to discuss. Like we all have a lot of questions, so we'll carry on. We have lunch back at the office. Is that right?
Yeah.
We ordered lunch. We ordered lunch, so you know, if anyone wants to come back there, please do, and then we'll have a bit of lunch, and then we'll have our research meeting after that. Oh, yeah. So before we end, we'd like to give you some gifts to thank you for being here. Oh, okay. Oh, yeah, running. Yes, correct. Yeah, gonna give the gift that quote. Okay, yeah, give the gifts that quote. That's what I thought.
These are our grocery bags, big one. Oh,
Thank you.
And we have another one for here. Well, you get one too.
Thank you. See you, team.
Thank you.
Yeah.
We also have some gifts to give.
Organized and ready. No,
I'm gonna get them at the meeting.
yeah, let's get them.
We'll give you some gifts at the meeting, but Yes, thank you.
Tony,
Ah,
we're hosting you.
Thank you.